The healthcare sector is an inspiring place to be, and the benefits of technology can be seen in every aspect of it. Our doctor appointments and health emergencies are always hard to keep track of, but new technological developments have made this job much easier. Traditional approaches to patient track records and data collection have always been carried out manually. Historically, this has proven to be timely, costly, and inexact. However, the development of digital solutions is looking to benefit the healthcare sector in a variety of different ways.
So South Central Ambulance Service is a very large patch. It stretches from Milton Keynes across to Banbury and then all the way to the south coast. So it's a very large trust with 13 different hospitals within that patch, some over the borders as well. And we've got a population of about 4 million within there. We do have some challenges. We have areas that are rural, which obviously means that potentially that you've got low levels of population, which means that creates some challenges. We've got dense areas as well, such as Portsmouth, Oxford, Southampton, and in there, of course, we get our challenges and a lot of inner city challenges that perhaps you would often see in London, for example. So every single ambulance service here in the UK have what we call ACQIs, Ambulance Care Quality Indicators, and these are measures to ensure that patients get the best possible service. For example, if someone's having a heart attack, we have certain things that must be done for that patient, and that must be done across every ambulance service across the UK. Historically, of course, we've relied on paper, which means that we need to have people reviewing that clinical information, and that's not only expensive, but it creates some real challenges as well. Now that we've got electronic patient records, that allows us to automate the process, so our information will be more accurate. And this is really important because it then means we're compared across other ambulance services. So there's a reputational issue here, and it's important that our data is absolutely correct. Having EPR allows us to get the most accurate information, and that for us has been a significant improvement.
Delivering the right clinical data at the right time can make all the difference between life and death. Therefore, the opportunity to use cloud storage solutions and live data sharing devices is already showing significant impact for both practitioners and patients.
I think we've seen only the starting point, and I think this will increase during the years. And I think especially solutions for taking care of monitoring outside the hospital. And it's mainly because it's very costly for the society when patient comes into the hospital without having to do that. So part of our solutions is really that you can judge, is this really necessary to transport this patient, but also you can do a lot of advanced treatments at home or with the paramedics. So digital solutions, they are here, but they will just increase more and more. And going into the future, it will also be different systems. So I would say integration between all those digital systems, that's really key, because then you can have like a seamless flow of information instead of separate islands with information. So I think we just see the starting point of where we're heading.
Frontline vehicles, that allows us to capture real-time data looking at all of our conditions, and that's been incredibly helpful. Obviously our crews had to go through advanced training to be able to use electronic patient records, but we've certainly noticed that since November 2016 there's been a real significant improvement in data collection.
So without an electronic solution, when we were using paper in the past, we make referrals to various specialist teams. We do that on a paper-based solution, but the referral would then have to be made at the end of the day via a fax. So that relied on the crew obviously completing the form and then storing it securely on the ambulance, and then at the end of the shift taking, or when they got back to their base station, which may have been at their lunch break or at the end of their shift, would be to fax that report off to the relevant team. With an electronic solution, staff are able to send that directly at the time that they're with the patient, so they would complete the form and they would email it off straight away, which avoids any potential for it being forgot to be done or any concerns. So one major advantage of the EPR is with paper-based solutions, the paper report would have to be securely stored on the ambulance throughout the patient contact and for patient contacts after that, until the ambulance was back in a place where they could be securely kept, which would be the ambulance station. With an electronic device and an electronic solution, and once the patient record has been completed, it's signed off digitally and then locked, so it's secure almost instantly.
So with our electronic patient records, we're now doing some quite incredible work, some groundbreaking work, and probably some of the most innovative stuff within any ambulance service in the UK. We're now able to map, for example, trauma. So if we want to look at road accidents, motorcycle accidents, stabbings, those type of conditions, we can look with real accuracy now to perhaps decide on our prevention strategy, on how we want to deploy our ambulances, what time of day we should be deploying to, what day of the week, and we do see variation certainly. For example, Fridays we see a significant rise in the number of road traffic collisions that we get. And by doing that, we can also think about our staff welfare. If we've got an area where we're getting a lot of violent crime, then we can think about potentially improving that.
Data is key not only for treating patients, but also for providing healthcare professionals with the necessary tools to analyse and predict certain conditions, consequently preventing them.
So South Central Ambulance Service are already using the data from our electronic patient devices. Historically, we used to take our information from the CAD, which is where the 999 calls are recorded. That's notoriously unreliable. A patient may say that their mother has collapsed, and when we actually get there, she's fallen, so it means that the data is really, really difficult to work with. This has transformed that. What that means is we can now get real-time data from the clinicians who are actually with the patient, which means that the information is hugely accurate compared to how it was before. One of the things we've done in South Central Ambulance Service is to start looking at trauma and mechanisms of trauma. So for example, we've looked at stabbings, at hangings, at all sorts of different things, including road traffic collisions, and we are getting some really groundbreaking data on the basis of that. And that information is really valuable for us because it allows us, for example, to change our deployment plan, where we put our ambulances, what time of day we put them. For example, do we put them out in the evenings, even looking at the days of the week. And by doing that, that means that potentially we can work more efficiently and better serve our patients. There is also a prevention theme as well. If we find, for example, there's lots of stabbings in one particular area, and we do see that, then potentially we can work with our other colleagues, such as local governments, police, etc., to try and drive that down to make sure there's an improvement in patient care.
We work with lots of data. From when the point of call, somebody calls in, either a caller or a patient, so we have telephony data. Which is the types of data of what time did the call come in. It's the first few questions that are asked, or we're trying to establish whether the person is breathing and conscious. Then we go into CAD data. CAD data is the tool that we use that dispatches ambulances. It also tries to prioritise the call, so how quick a response we need to get to that patient. We also go through a system called Pathways, NHS Pathways, which is where we triage the patient and try and diagnose further what is actually wrong, and that will determine as well the type of response that we give. Whether that be, and it might not be an actual 999 response, it might be we direct them towards the 111 service, to out-of-hours GP, to a pharmacy. So all of that sort of information is available to us. But if we do send a resource, then we use the EPR data, and from that we record, more information to do with the patient, what was wrong with the patient. We have, other information that is interacting with it from the ZOL, which is it's capturing kind of time recording, medical devices, things like that. We also interact with other systems as well, so radio operating systems, so the Terrafixed. And that records kind of things like what time did they get on scene, what time did they leave scene, what time did they arrive in hospital. Even if we don't transport the patient, you can capture on the MDT, which is it captures that we left them at home and we perhaps directed them towards their own GP or self-care. So we're quite lucky really, we're quite rich with data in our organisation.
In the case of ambulance services, data can help with mapping different types of trauma and the planning of a better prevention strategy alongside ambulance deployment.
So although we focus largely on trauma, for example, and we've got some good evidence for that, we can also look at pretty much any medical or surgical condition that we want to. So we've very much focused on trauma and particularly on knife crime because there's been a lot of national interest about that. But we've actually could do it for anything, including, for example, flu pandemics, that might be a good example, or respiratory problems. We often see a peak in respiratory problems in the sort of autumn months. We're able to map that, and potentially, if we use that properly, we could even use that to help with our medicine strategy. For example, when we need to order our salbutamol, our nebulizers in stock. So potentially we could really use that as an improvement in the future.
On a day-to-day basis, we have to report nationally on how we're performing contractually. We have to report on operational information, so for example, how quickly did we get on scene, and the different level of responses. So we have certain targets that are placed on us just to measure performance. So we're able to gather that from all the data that we have available to us. Through the introduction of EPR, we have even further information. So we have clinical indicators also as well that we report regularly on, monthly, that I tend to be on. But that is measuring our performance on the types of patients like cardiac arrest patients, stroke patients. So if we didn't have the type of information that we have available to us, it would take a long time for us to clinically audit all of those records. So while we're capturing all the data on all these systems, we can quickly come up with how we are performing on each element, whether we're passing or failing. All of this information we can pass back to individual members of the teams to say how they are performing. We have regular reports that we send out to commissioning groups. The CCGs, the clinical commissioning groups, they are kind of responsible in each area. So there'll be lots of ones throughout the country. They are responsible for directing where funding is going. So we send monthly reports to them so that they can look through the data, look through the demographics, the presenting conditions of patients, to see whether further funding needs to be put towards GPs, towards mental health services, towards hospitals, things like that. So they try and direct that, and that they kind of, hopefully the data we're gathering is helping them come to make good decisions where funding is going.
One of the big problems the NHS faces is the lack of resources. The main benefit of the application of digital solutions in the health sector is the reduction of hospital visits when not necessary. This allows clinicians to focus on the most critical cases. It saves valuable financial resources and improves the quality of service for patients themselves.
The use of data, it's amazing. Even in the 3 years that I have been working on the data in this organisation, has changed so much. People are beginning to use apps to find services. You know, paramedics on scene often have apps to help them find an alternative pathway for a patient when they don't think, you know, transporting the patient to hospital is the right outcome for them. We are beginning to work closely and share information better with GPs, with hospitals. We're beginning even to get from hospitals more outcome data of actually, you know, how was the survival rate, when were they released, what actually was wrong with the patient when they got to hospital. And the sharing of that information is very useful for us as well, because it helps us learn, it helps us again forecast for what type of patients we have out there, learn if they're, you know, how we can improve our service to them. So I think for me, data in the future would be, you know, the sharing of data, more collaborative information being passed to and from people more seamlessly, faster. That's the way I would like to see data heading.
Most important when develop new functionality or a new solution is that it's reliable and that it's robust, but also that it really fills a gap. So it's a need from the physicians or from the patients. So that's really key. And there is an easy rule about success for new products. So a new product needs to fulfill minimum 2 criteria, or at least one of the criteria. It needs to be cheaper, giving the same clinical result, or it should be improved clinical result for the same cost. But really, to be new and innovative, you should deliver better care at lower cost. So that's the key thing. If it doesn't fulfill any of those things, it will never be sold, it will never be a success. And I would say Artivo Solutions, we can prove that it's have both. So you have a cost reduction, but also you have a better clinical outcome. So I would say running with the EPR system will probably be a requirement in the future.